Hello, everyone. I'm Steve with Fitness for Five. You can check us out online at fitnessfor5.com. It's all spelled out. So we're here with our series, Dr. Nario again. And today we're going to talk about a high dose C. I think it's called a Mega C. So welcome, Doctor.
Hi, Steve. Thank you again for inviting me.
Okay, so what is a high dose C? What's a Mega C? Also called that, I think. So what is it?
All right. Well, let's start with the basic definition of vitamin C. What is it? Just to recall, I know I discussed this before. Vitamin C is a water-soluble vitamin. It's a non-toxic vitamin, and it does not accumulate in our system. It gets eliminated by urination. And we always hear vitamin C related to the word detoxification and even cancer treatments or prevention or even infection fighters. And the vitamin C actually has two major functions. It's an anti-inflammatory and it's also an antioxidative therapy. So free radicals, they always go away because of the donation of vitamin C to the free radicals to neutralize them, thus decreasing the levels in our system. For several conditions, we use this a lot. You would hear about heart problems, cholesterol issues, autoimmune disease, fibromyalgia, infections, and even cancer. So the two functions that I can emphasize with this talk is vitamin C changes its function in relation to the dosing. When you give low doses, such as less than 15 grams, you get the general immune and antioxidant support for the body. But if you go higher than 15 grams, now you produce the oxidative purposes or the power of vitamin C, meaning delivering more oxygen to the system to kill infections and even cancer cells and spare the healthy ones. And this is the one that I want to emphasize with this talk when we talk about higher dosing of vitamin C rather than the lower doses that we usually see.
Okay, so what's a high dose?
Okay, well, a high dose is, as I mentioned, is greater than 15 grams. Anything, because when you get Myers cocktails, they have lesser levels of these, but you always go for the higher ones when you talk about major infections and autoimmune disease and illnesses.
Okay, so if you're going to do a high dose vitamin C, you do it through an IV drip intravenously. Is that the best way?
Yes, so Steve, that's a common encounter that I always talk to patients about. They always tell me, why do I need to get an IV when I can do this orally? Yeah, okay, you can do it orally, but if your gut and you're crying from your backside when you're taking high doses of vitamin C, that's a different thing. The reason for that is the most desirable way to absorb vitamin C is through IV. The reason is oral C can cause gastric or intestinal irritation. The limit of our body is mostly around by 2,000 milligrams or 2 grams. We already feel that diarrhea effect and also the cramping of the abdomen. That's why when you go IV, you can go as far as 25,000, 50,000, 75,000, 100,000, depends on the need of the condition. And it can be given safely if given by a medical professional that's experienced with this type of technique.
So I know like a capsule has got like 1,000 milligrams in it. Now, when I come into your clinic, when I come in there to Biointegrative, I get 50,000 milligrams, right?
Yep.
That's 50 times what I can get in a capsule.
Right. And that's the wonder of that. When you talk about 50,000 all like clumped up in your hand and you shove it down your throat, yeah, that's definitely not going to happen. You need a plunger to push all those pills down. But with an IV, there it is, real quick.
So how does it work?
All right, so how does it work? It breaks down the vitamin C, the high dose of vitamin C breaks down into peroxide molecules. And yeah, similar to hydrogen peroxide molecules. And once peroxide is in your system, it interacts with your cells. The thing there is not all cells will suffer from the powerful effects of peroxide because it will kill or destroy abnormal cells, for the reason that normal cells has this enzyme called catalase. It's like a shield telling vitamin C or peroxide, don't harm me, I'm your friend. And the abnormal cells, such as the ones with infection or with cancer, does not have this weapon to protect themselves so that they cannot convert peroxide into water. And that's what normal cell does. It converts it into water. And infected cells or cancer cells actually has 10 to 100 times less of this enzyme, which is catalase, and cannot detoxify peroxide properly, and they just die off.
Okay, so in this form, it's making peroxide as a good thing as opposed to a potentially bad thing.
Yes, definitely.
Okay, great. So let's say I'm a new patient. Can I just walk in and say, hey, give me 50,000 milligrams of vitamin C? Is there, what has to happen? Can I just walk in and say, give me 50,000 milligrams of vitamin C, you know, put it right there? Can I do that?
Well, you can, but the thing here is I want to put special emphasis on the candidates who really needs high dose vitamin C. For normal individuals, yes, definitely you can, but not as an intensive program for the ones who needs it. Who needs this? Number one, anybody who's almost ill of any specific condition. But let's go into specifics here. Number one is infection. A proof for that is even during the 1930s to 1950s, high doses of vitamin C had been used with diphtheria, tetanus, and even viral pneumonia. Another candidate would be, which the ones we always see here in the clinic, are cancer patients. May it be early or late stage, you will benefit from high doses of vitamin C. The one that we're kind of cautious about when we give high dose vitamin C are the ones who are actually having cardiovascular issues, like congestive heart failure, bad swelling of the abdomen, because of the high fluids that are involved with vitamin C, which they cannot probably tolerate. And also it depletes you in a way, because it has a diuretic effect. That's why we're pretty cautious about that. And the number one, another factor that we want to keep an eye on are the G6PD deficient patients. So this is an enzyme that is located on your red blood cells. And when your red blood cells are faced with all of these peroxide molecules, if it does not have that G6PD defense, they will rupture and die. And that's why what's going to happen to this patient, if you are G6PD deficient, you will have what we call hemolytic anemia, wherein all your red cells will just burst. And this is something that you would usually, it's a genetic disease, and you would see this mostly in men. And one more thing is people who does have high iron levels, it's hard for them to receive vitamin C because it will be detrimental for them. It will increase the formation of oxidative radicals when interacting with iron in your system.
Okay, so because I know Dr. Majid, who is also there at the clinic, Biointegrated Health, he had me do some blood work or something first before he would let me do the Mega C. What is that test? Is that what you were just talking about?
Yes, that's the one. Okay. Anybody who wants a high dose vitamin C, that's a requirement. We need to get that level for safety purposes.
Okay, so you just wanted to check out my blood, make sure that the vitamin C would be a good thing instead of a bad thing for me.
Yes, that is correct.
Okay, so are there possible side effects? Like for someone like me, I've had the blood work, you know, I'm good to go with the Mega C. Are there any potential side effects from doing a high dose IV vitamin C?
Yes, even for the healthiest person out there who will receive high doses of vitamin C, we need to make sure that safety is the priority. And as I mentioned to everybody, 30 years of practice had given us that experience. And of course, the safety is always important. The experience of your medical provider should be inclusive of these requirements when where you get your high doses of vitamin C. So let's talk about common side effects. Number one, it lowers blood sugar. So during the infusion, we always remind our patients you have to eat, because vitamin C has the molecule arrangement similar to sugar. That's why your pancreas is thinking, all right, I'm getting sugar, and that's why it increases the insulin, thus facilitating entry of all your glucose in the system, depleting your blood levels. That's why food is always something important. Number two, as I mentioned to you a while ago with the heart problems, with patients with heart problems, it can cause diuretic effects, meaning you would pee a lot, and you would notice this, especially you, when you get the high dose vitamin C, you go back and forth to the bathroom. That's why hydration is very important. May it be during or even before or even after vitamin C infusions. Another one would be if the infusion runs so fast, it can cause pain on the vein, meaning it's actually an irritant to the lining of your blood vessels. That's why you have to do this very slow and very cautiously. It can also lower calcium levels. It has mild chelating agents. So we just spoke about EDTA last time. This one also functions the same, but in a very minute ability. And when you have low calcium for after receiving vitamin C, you would feel tremory. You will have fasciculations or cramping. That's why we remedy that with calcium. And the biggest scare that's related to vitamin C, high doses of vitamin C, is the formation of kidney stones. Because when you metabolize vitamin C, oxalates are getting formed, which if you're not properly dehydrated, it can actually cause renal problems. That's why we are cautious about when you get high vitamin C with patients who has pre-existing conditions. The higher risk that you have, the more risk of having stone formation, but it is preventable. Just giving nutrients such as magnesium and B6 and proper hydration afterwards definitely are preventive measures for this to happen. That's why even in Australia, they ran a study with this, and administration of a daily 300 milligrams daily through IV, even higher, daily, this is daily, resulted in a better health outcome for those specific patients that were included in the study. All of these are preventable. All these problems that I mentioned, as long as your provider understands how to do high doses of vitamin C properly and safely.
Okay, well, thank you, doctor. It sounds like a great treatment. So that's Dr. Nario at Biointegrative Health Center. I'm Steve with Fitness for 5. Check out our membership at Fitness for 5, all spelled out, fitnessfor5.com. And we will see you next time. Thank you, doctor.
Thanks, Steve. Thanks for inviting me again.